All right, I think we're going to get started. So we have our full hour to hear from our panelists and have our discussion. So good afternoon, and thank you all for joining our event, Empowering Mobility Together, FTA Section 5310 Webinars in Collaborative Forum. My name is Jane Mahoney, and I'm a Training and Technical Assistance Specialist with the National Aging and Disability Transportation Center, which we affectionately call NADTC. And I'm really excited for today's discussion. So this is the first of a two-part webinar series with an online discussion forum that accompanies through these next 2 weeks, so that the things that we're discussing here today during the webinar can be carried on in the discussion forum. Our webinars are really meant to be interactive. We want to have a discussion between our NADTC staff, our panelists, as well as our audience members, all about the planning, the conceptualization, and sustainability of Section 5310 programs. We have 3 panelists joining us today that are going to talk about their experiences, their successes, and their challenges with the 5310 funding. But we also really want to hear from our audience members as well. We're going to have some polls that we'll be doing as well to encourage you to ask questions or to offer your perspective on the topics being discussed. So before we get started, we'll go over the quick housekeeping issues. Everyone is muted. However, if you wish to ask a question audibly, you can request to be unmuted. And as with all of our events, the session's being recorded, and the recording will be posted after the webinar in the online forum. We have AI Media providing live captions for us today, and the captions can be viewed by clicking the CC button on the bottom of your screen, or you can click the link in the chat in order to view them online. If you have questions at any time, you may raise your hand to speak or use the Q&A button to ask your question. We encourage participants to freely ask questions as they arise instead of waiting until the end. And when we get into questions that might drill down to a more specific situation at your agency, we'll probably ask that you address that in the online forum. We also have the chat open for any general comments or technical assistance needs. A little bit about NADTC. We are a federally recognized technical assistance center that's funded through the Federal Transit Administration with guidance from the Administration for Community Living. NADTC is operated through a partnership between Easter Seals and U.S. Aging. And our overall mission is to promote the availability and accessibility of transportation options that serve the needs of older adults, people with disabilities, caregivers, and communities. And we strive to meet our mission by providing resources and support to help agencies solve transportation challenges. And we do that through our technical assistance toll-free number, as well as email, where you can ask any types of questions, and we'll have our professionals respond to you. We also have a website that's full of publications and resources, as well as a photo gallery and a monthly blog, all focusing on accessible transportation. Many of our resources have a focus on building partnerships and coordination, as we believe this is vital to the success of community transportation programs. And finally, we are finishing up our latest round of community grants, and this year they were planning grants in rural areas. And you can read about our 11 amazing grantees on our website. You can find us at our website at nadtc.org. You can subscribe to our monthly e-news or find us on social media. And now we're going to get to our panelists. And I've asked each of them to just give us a really quick blurb about their agency and themselves, just a little bit as a teaser. And then as we go on with our presentation, you're going to be learning more and more about them. So we'll go ahead and start with Jess.
All right, thanks, Jane. Hi, everyone. I'm Jess Maffey. I'm a statewide transit program manager with the Virginia Department of Rail and Public Transportation. So we are the agency that administers the FTA transportation funding for the state. We are separate from the DOT, so a little bit of a unique agency. Hi, Tony. I see some of my grantees in the chat, but for those of you unfamiliar with DRPT, so I'm the Section 5310 program manager for Virginia. DRPT is the direct recipient of this funding, and we manage the funding for rural, small urban, and the large urbanized areas of Richmond, Hampton Roads, and Roanoke. And so our scope includes the entire state outside of DC, the DC metropolitan area, as that is managed by the Metropolitan Washington Council of Governments, or MWCOG. So our program provides funding for vehicles, replacement and expansion vehicles, operating expenses for public services only. And we also provide other capital funding under which falls mobility management, contracted transportation, and software. So this program, just to give you a little context going into our discussion, is a competitive program that grantees apply to every year. So it's a little interesting in that way because we do have new grantees who come in every year for funding. And also want to note, and we'll talk about this more later, that DRPT creates our Coordinated Human Services Mobility Plan, which is an FTA requirement. So that's also something different than some other states do, but it comes from the state level here. All right. Thank
Super.
you.
Thanks, Jess, for joining us. We're excited to learn more about you. And we'll go on to Lucinda.
Hi, everyone. I'm Lucinda Shannon. We're the 5310 subrecipient. I'm a senior regional planner at the Thomas Jefferson Planning District Commission. We're a regional planning body for the Charlottesville area, which also includes 4 rural counties. And half of my time at the planning district is dedicated to our 5310 mobility management program. I'm the mobility manager. And we started our program in 2024, so we're pretty new, with an information and referral call center. And now we're also offering travel training, informational workshops, and we support the expansion of volunteer driver programs. Our program name is PATH. It stands for Partnership for Accessible Transportation Help. And you can learn more about our program and activities on our website at www.pathva.org. And I'll put that in the chat. Thanks.
Great. Thank you so much, Lucinda. We're excited to have you here too. And we'll go on to Kristen.
Hi, I'm Kristen Lamprosa. I am the Director of Regional Mobility Planning and Partnership Programs in a little bit outside of Northern Virginia. And I cover a 5-county region. Our program has been accessing funding through 5310 funds for about a decade now. And we have grown and transformed quite a bit in that time and learned how to use our funding in a lot of different comprehensive ways, which we're excited to share in today's webinar. I have been working for the planning district or the regional commission office in this capacity for about 6 years now, and we have been working closely with our state representatives and also with our neighboring region, which is what Lucinda covers. So yeah, thank you.
Awesome. Thank you all. And we are going to get started. I'm going to stop my screen share so we can see each other a little better and find my first question. Sorry. Okay, so we're going to start by talking about the conceptualization and planning part of these programs. And so I want to ask Lucinda and Kristen both as subrecipients, how did you identify the need for your 5310 funded projects or services? A lot of times we know the need is there, but can you tell us how you were able to identify the specific needs that prompted you to apply for the Section 5310 grant funds? Want to go first, Lucinda?
Yeah, thank you. So as a regional planner, I'm on a lot of committees and bodies. And one of them is a coalition of aging service providers. It's called the Charlottesville Area Alliance. And I was on the transportation working group for that committee. And their main goal was to increase transportation for older adults. So I heard a lot about the need for transportation for older adults from human service providers in the area. Also, our regional paratransit provider, John, had the mobility management program, and at some point they asked us if we wanted to take it over because we're a regional body and we have contacts with all of the service providers in the area, so they felt that it would be better situated in our office. And then also the community health implementation plan from the Blue Ridge Health District identified transportation for underserved populations as one of their top priorities for the year. So it just kind of all came together through those partnerships. And right away, we met with DRPT to discuss ideas for the application and the priorities to make sure that we were on the right track. And Jess connected me with Kristen, which was fabulous. So, DRPT kind of suggested that we look at Kristen's model as far as coordination. And we met with Kristen, and she was very helpful in applying and preparing our application and better understanding how coordination can work on a regional model with multiple partners. So our programs was, as far as the application goes, we had the support of the local plans like the Community Health Implementation Plan from the Health District, and then also Charlottesville Area Alliance has our area dedicated through AARP's Livable Communities program. And so their first grant, our first year, they got a grant from the AARP Livable Communities program to support our program and continue our work through that. So we had a lot of support with that. And as far as finding partners, I found most of them through the Charlottesville Area Alliance Coalition. We have the Regional Transit Partnership in our area, which is a group of transit providers and also stakeholders around transit. And they've been meeting for many years. I've been on that committee staffing it. So I gave updates to everybody. I was like, we're applying for this. Here's what we want to do. And people were really engaged. So that helped me. I already had those relationships with the transit providers in the area, and they were very supportive too.
Fantastic. That's a lot of great coordination that you went through. And that's just what we discovered, that coordination is so important in getting all those partners from the community. Kristen, do you want to tell us about your experience of how you really found and figured out what the need was and how you decided to work on your program?
So actually about 10 years ago, when we started pooling 5310 funding, we heard from 3 different sources. So we actually heard from our public transit providers that there were lots of needs that they were seeing that weren't really able to be satisfied by the services that they were being provided. So they naturally identified gaps in people trying to reserve rides or take transportation options that were not available at the time and reported that. From that initial report, we actually linked up with an aging services and supports group that had community conversations with a whole host of different folks over the course of about 3 years. And so they were meeting frequently with community members and really talking with older adults and people who were trying to access transportation options, and kind of started hashing out what were the real challenges that they were being faced with. Was it route challenges? Was it due to service times? What were the issues? And so we got a lot of great information off of those conversations about accessibility as a whole and what that type of population was looking for in regards to transportation supports. And then lastly, we heard from a health foundation that was invested in supporting solutions for older adults to get to medical appointments and to follow-up care. And so this health organization was kind of had it on their radar to really focus on this population's needs and realized that transportation was a big kind of gap that wasn't being addressed. And so when we put all 3 of those sources together, you kind of paint a picture of there really is a need in this area for some kind of human services focused transportation. And from that, we developed our first round of funding, which was really about kind of pulling in a contracted service and a very basic option to introduce a call center to our community. And over time, we transformed that greatly and went back to the public when the administration shift during one of the presidential shifts. We realized that some transportation funding was going to be shifted away at the federal level, and it was going to trickle down to the state level, and that would have community impacts. So we went back to our community at that point and went through a mitigation process where we set up town halls. We set up opportunities to meet and engage with stakeholders that were both traditional and non-traditional. So really going beyond our sector of transportation into Department of Social Services, into housing services, into food support services, and really talking with those folks about what the challenges were for the people that they were serving, which happened to be a very similar audience to what we were serving, and where the overlaps were. And so we identified even more needs and went back to 5310 funding and kind of transformed our whole program around to mitigate that federal shift of funding, and then to also kind of reinvent what we were doing and expand our funding and really try to implement a more comprehensive program, which is what we've run over the last 6 years. And that program has taken that mitigation process of kind of engaging with non-traditional stakeholders and really made it a part of our normal operations. So we engage with partners all throughout the year that may have nothing to do on the day-to-day with transportation, but they're serving the same audience that we are in some capacity of their own sector. And so through those conversations, we've been able to glean a lot of information and continue to grow and adapt our program to the changing needs of our community.
Fantastic. That is great. Lots of community engagement and finding out where the need lies. Jess, so as the direct recipient, how did you identify and prioritize local mobility needs?
Yes, so as I kind of mentioned in my intro, DRPT is the creator of our coordinated human services mobility plan. So we do it at a state level, and we update that approximately every 4 years. And as part of that process, I mean, for direct recipients or the people who do the plan, they're familiar with the requirements, but there are several FTA requirements as part of that plan, which include going out, identifying the gaps, the needs, and then creating strategies to address those needs. And so for our statewide plan, we have the state broken up into 6 geographic regions, fairly large regions, but that kind of share similar features. And then basically out of that, we do the statewide outreach. We focus on, what are the regional gaps. We kind of identify what are essentially the priority gaps in that area. So there's a variety of different types of gaps: surface accessibility, it could be funding, it could be just the availability of transit at all. Just kind of depends on the area. And then basically we create like an action tracker for the entire state that lists out all the gaps and then the strategies to address the gaps, and then specific sort of project types or actions that would relate to those gaps. And then we prioritize, basically we give each region priority strategies to complement the gaps that we see as most prominent in that region. So basically that's how we kind of identify that and distill it into something people can follow along with. And then when grantees apply to our program, we ask them to identify which of those action items they're addressing as part of the plan. And we look and see, make sure their project aligns. And then since it's a competitive application, we score the applications, and there are points associated with how well they're aligning with those strategies in the plan. So we try to make sure that we're kind of integrating the application process with the plan and making sure the people applying are kind of aware that they need to be thinking about these strategies and how they address them.
That's great. I love the how much effort you put into making sure those projects are meeting the needs that you have identified. So if someone's applying, and it could be a great program, but if it's not really easily fitting into where your identified needs are, it might not get chosen. So that's really interesting. And I know Lucinda had said that she connected with DRPT right away when they wanted to apply, which I think is a great idea. Go ahead, Kristen.
I was just going to say, it also presents a really great opportunity for grantees to align their projects with opportunities. So if they're seeing trending needs in their area and it aligns with objectives and strategies that have been identified in the coordinated plan, it gives them the opportunity to capitalize on that moment to secure grant funding and coordinate with the RBT to come up with solutions. Versus you may have an issue or a project that you want to work on, but you don't have a partner aligned, or you don't have any other additional funding aligned. And so you may wait on those strategies and take advantage of the strategies that do align with the project at this time. And so that can change from year to year, which is also a great opportunity as a grantee to not be stuck in only one type of project for many years. You can kind of reinvent those projects and kind of reprioritize every year based on the way that Virginia sets up that plan.
It's really interesting how each state or region does this uniquely. And so thank you for sharing that.
I think this is Carrie. I think this is a great way to use that planning process. And Lucinda, you had mentioned about the CHIP plan and AARP livability. I know a lot of other agencies, aging programs, independent living centers. There's a lot of plans, community needs health assessments out there. And I love that you're integrating those. Do you have any suggestions for others on how to make those connections if they currently don't have or know where those plans are, or a lot of times they have transportation issues, or if they have a clinic of some sort, people need to get there. So they may not have identified it as a priority yet, but it could certainly fit into some of the coordination plan priorities.
Yeah, I would say go to a lot of meetings, but if you're not plugged in like a regional planner, I think it would be hard to find the right meetings to go to. But I think asking questions, contacting planning agencies in your area would help a lot, and just start asking people, like we had that aging coalition, which was really great, and JABA helped form that. So, connecting with your area agency on aging, and then also your transit providers and the planners who help plan transit. They're a great resource too. And I just also want to say, like, the flexibility from our coordinated human service implementation plan, that is really helpful for us, because as a new program, we started off, kind of with the information and referral center, and we learned so much in the first year, and then started doing workshops and travel training. And I think every year for us, and for the probably first 5 years, is just going to be evolving and growing in different ways. So it's really nice to have that flexibility and also the guidance from the state plan.
Thank you. Any other thoughts on that, Kristen or Jess?
Yeah, we have a couple of questions in the Q&A. So the first one, I would love to know what the panelists think of the need for or ways to reduce duplication of services and tools like trip planning tools, etc. One can use 5310 for a broad range of solutions, and I wonder how agencies can be supported to do more together.
So I'll take the lead on that one.
Thanks, Kristen.
The best way to reduce replication or duplication of services is to bring everybody to the table. It sounds very cliche to get everybody to kind of play together in the sandbox, but it really is the best way to come up with a strategized plan that's using your resources efficiently. So even if those resources are from region to region, or even state to state, where you're having these, invisible locality lines that our clients don't really see on a day-to-day, but they're going beyond state lines. You want to have those programs talking to each other, even though they are separated by a locality line. And the only way to do that is really to invite people to engage together. We have introduced a working collaborative model in our region, and really present opportunities continuously throughout the year to get folks together and talking to each other and working together on bringing in applications that they pair together, that they partner together, or working on projects together. And we facilitate a lot of that so that we make that engagement as easy and as doable as possible. When you're thinking about how agencies can be encouraged to kind of work together more, Virginia also does a really great job of doing that with their grant administration. They encourage programs to work together and kind of grade us on that as well. That's one of our kind of metrics, is how many partners do you have and are you coordinating with to provide services or transportation supports? And it helps to encourage programs to work together, because they're going to be rated higher if they have that partnership and that communication with their neighbors, so to speak.
Thank you for that. There's also a question for Jess. How can transport researchers help agencies like DRPT identify and address the needs in their plans? What don't you know or wish you could know? Or maybe there's no formal method for you to understand some needs systematically.
That's a great question. There's certainly challenges with understanding all of the needs in a comprehensive way. I'll be honest, we are actually in the midst of our update currently to our coordinated plan. And I think what I'm finding is that we hire consultants to help us with this plan and go into the data and do surveys and do outreach, and we're doing focus groups. So we take a lot of different approaches at the state level to, try to find out the needs and sort of have an up-to-date understanding of that. But I think at a broader level, I think it's, to me, I'm thinking about how we can go beyond just this planning process and like every 4-year update, and sort of identify topic areas that come out of this plan that might warrant more of a deep dive. And it's just something that's come up in our conversations, like with our advisory group, where it's like, okay, within the scope of this plan, we may not be able to go deeply into, for example, I'm just thinking of the disability community. There's like a huge range of different needs in that community that can be different from older adults, and yet this program serves both. And so to me, I'm not sure if I'm fully answering the question, but I think there's a lot of opportunity for getting a little more specific into different needs and how they work within a context of a region, or like what options are available or what aren't available, and how people are actually accessing those.
Right. Understanding the barriers better, yeah. Right? For those populations, how they're different.
Yeah. So yeah, I mean, I'm always interested in talking to people about and learning about research that's going on. So feel free to reach out if you have ideas for that.
Great questions. And again, we can carry these discussions out into the chat, into the forum after the webinar. So, and then one more to that point, if there were one thing that you would like to see changed in how 5310 money is used, what might that be within statute, of course? Anyone?
Yes, the easy answer for that is transportation replacement services. So we tie all of our funding to an actual person in a vehicle going somewhere. But there are at times where it makes better sense strategically and maybe financially, and for that person to have a transportation replacement service, like a delivery, like a pickup of a medication, like a delivery of food, things like that. That would be awesome to be able to have a funding source for that, which is typically very difficult to find.
Great answer. And this too, I think, would be a really interesting thing to put in the forum online. So I think we're going to do a poll.
Yes,
Right,
and I
Karen?
add something about how, what we've seen nationally with the 5310 funds is not necessarily what would change in statute, but to ensure that states and regions know that the program can fund much more than just vehicle replacement. It's not a huge amount of money, but in the hands of nonprofits and other local communities, it can make a huge difference in terms of transportation for older adults and people with disabilities. And so I think not just other ways that you wish it could be used, but ensuring that you're looking at the diversity of the programs that it can currently fund and how those could fit within your state or regional plan.
Yeah, great. We're interested in how our attendees are involved in the coordination planning process. So there's 2 questions there. If you would answer them.
So the first question is, are you involved in the coordination planning process? And you can answer yes, no, not applicable, or not sure. And then if you scroll down, there should be a second question. What area does your coordinated transportation plan cover? Could be local, like a county, regional, statewide, not sure, or not applicable. So I see that we have about 10% of people responded right now. So we'll leave it open for just a little bit more and see if we can't get a few more responses. Wow, it went from 10% to almost 90. So we'll give you about 15 more seconds.
I did want to say that I did look at the attendees here today, and if I can remember, I think 68% of the people that registered for the webinar today do receive 5310 funds, but over 30% don't. And I thought that was a really good telling that community organizations and that don't receive funds are interested in accessible transportation. So that's fantastic.
So the results are in. So 66% of those on this webinar are involved in the planning process, 22% no, and then 11% either not applicable or unsure. And then of the 99% of everybody online who responded, 26%, so about a quarter of their plan is local. Almost half, 46%, it's a regional plan. 9% it's a statewide plan, and about 20% they're unsure or it's not applicable.
Great, thanks, Carrie. Okay, I think you can see the results we went through. All right, do you want to move on to the next section? Thank you all for a great discussion on the coordination plan.
You couldn't see the results? I thought I shared them.
I think they did. I think we're good.
All right, so I'll stop sharing. Okay, thank you.
So the next thing we were going to ask for all of you is, what challenges did you have when you were engaging people the most in need, and how did you overcome them? How did you reach the people in your community that you feel like are really have the most need? That can be tricky. So community engagement methods.
So we conducted a survey. It's hard to reach the people in need, especially when you're covering an entire region and it's not just, your neighbors. So we worked with service providers who work with people in their areas. We attended interagency council meetings and spoke with people who work directly with our target audience, older adults and people with disabilities. We conducted a survey through them where they answered questions, and then they also asked their clients to answer questions. And we conducted focus groups of service providers who work directly with our target population. And then because I'm part of a lot of committees, I gave a lot of updates to people, to like transit and aging groups and elected officials in like commission meetings. and the Regional Transit Partnership, talking about our application and our plans and everything, getting feedback that way. And through that process, the University of Virginia offered us funding to help hire a consultant to produce a marketing study. And we weren't able to finish that during our application process. It was after our application, but that was really helpful for us. We were able to use the consultant to conduct a survey and focus groups with the target population themselves. And we use partners like the Area Agency on Aging to help organize the focus groups and distribute the surveys, because again, it is just really hard to get participation like that. So we were able to go to community centers and senior centers and talk with people directly there. And it was really eye-opening for me to learn each of our counties is very different and kind of has different cultures. So it was really nice to like see like one county was like, we do not want to ride the bus. We want to ride with people that we know, where it's safe in a car, and which was just unexpected for me. So I learned a lot through those focus groups, and it was really helpful.
That's great. Something I love about that, in the previous job I worked with, area agencies on aging and ADRC, that they all also have to do plans. And so being able to work together on that, you're killing two birds with one stone. You're finding information out that they need to know and you need to know, and you can even coordinate some goals together. So I love that idea. And it's always interesting how you are surprised by what you think you know, and then you're like, oh, that happens to all the time. Kristen, did you have something to add?
Yes, for our process, we did a lot of what Lucinda did, but we also hold yearly strategic review kind of analysis meetings with all of our partners and any kind of stakeholder or program that we interact with all throughout the year. So we go back to those programs and we talk with staff that are interacting with the same audience that we serve. And we're really trying to kind of dig into some of the trends and the information that they're seeing and some of the challenges and the barriers and how those kind of have transformed over the year. For example, in the last few years, we've seen a real influx in need for transportation to and from dialysis. And a lot of our programs, partner programs, have also seen some of those barriers for their individuals who are under dialysis care. And so it's a unique opportunity to hear that perspective from the provider and what they've had to do and change their processes to be able to meet needs or consider folks who have transportation issues. And then one of the kind of challenges that we face with that type of engagement or engagement with the public is what to do with the information that we gather about people that don't fall into our target audience. So we're often finding information out about kind of a sect of people that are typically between age 30 and 50. They're under that older adult age and they don't have a disability, but they are struggling and they do have their own transportation needs that we would love to address as a community, but we don't have widespread funding to support that. So our challenge has consistently been what to do with that information, where to put it, where to find funding to address some of these needs, how to incorporate our larger solutions so we can, kind of create a more livable community overall. And so that's kind of just a repetitive issue that we deal with every year.
Excellent.
Great. So we have a poll about engagement now. So I am going to launch that now, and it's 2 questions. So if you scroll down, you should be seeing the survey. Question 1 is, what is the most effective community engagement strategies you used? And it only allows you to pick one for this one. So it has surveys, groups, community meetings, listening sessions, pop-up events, online tools, and or apps or other. And if you do pick other, feel free to explain in the chat. The second question is a short answer. Are there specific platforms or tools you would recommend to others? And this was a learning experience for me because planners really are heavily engaged in community engagement and know all of the apps and the tools that they've used for years for this. That's not how I was trained. And so some of these apps and tools were new to me and maybe new to you. So I'm really excited to hear what your responses will be. So I will let everybody respond. We have about a 40% participation. We'll give you just a few seconds more because there is a short answer. And that might take a little longer for some to type. Still have people participating, so thank you very much. Once it slows down a little bit, in a few more seconds. All right, so I will end the poll and I'm sharing the results, so you should be able to see them. But we are the response for strategies. Surveys came up to the top with 23%. Focus groups at 11. Oh, I'm sorry. Surveys was not the top, but it was 23%, about a quarter. Focus groups was 13%. Community meetings was our top vote getter at 43%. 4% listening sessions. Pop-up events were 11%. We'd love to hear if you wanted to raise your hand and let us know what type of pop-up events that you do. 5% did online tools or apps, and 2% had other. I'm not seeing anybody responding in the chat for those yet. Let me see, where are the short answers? Do you know where those are?
Where those short answers go either.
I found it. So short answers: MPO, RPC coordinated human service transportation committees, social media, community activity boards and meetings. Someone recently designed an AI survey tool, social media platforms, assisted ride scheduling platform, schedules rides, but also has great selection of reports organized in a date range. A combination of all things and meeting people where they are to access the information. So going where people are instead of asking them to come to your meeting. This is a very good point. Technology changes rapidly, so there may be a tool now, but keeping up with the latest trends is important. AARP livable communities came to this person's New York City suburb in 2007, and transportation was the #1 identified need for older adults. And I think that speaks to what we were talking about earlier in terms of might not just be your plan, it might show up elsewhere, and it's good to find that out. Social media, creating videos, focus groups, Zoom and social media, using a professional. This group used University of Minnesota, guided the focus groups. Constant Contact is a platform that you can do email lists and e-news. Provider interviews, impromptu interviews with the Independent Living Center. Yielded a fantastic discussion. And then interactive mapping using GIS. We have Remix is another one of the online tools. Let me see, Survey Share, Survey Monkey, and going to conferences. So we can share those later. In the chat, we had Meals on Wheels distributed paper surveys. So those are all some ideas for community engagement methods. So I stopped sharing the poll now. You may have to close it online. There is one more pop-up events because I could not choose community meetings but as well. Events like health fairs are always great. And again, that's going to where people are. There was a question in the chat that I wanted to pose to the group. And Kristen, thank you, typed a response already. But how could a small transit agency utilize 5310 funds to support services for seniors and people with disabilities? And Kristen suggested one idea of volunteer transportation programs. Not sure if you want to expand on that. And just, I know you just responded, but if you want to come off mute and talk through what you have written.
Kristen, you go ahead if you want to talk about the volunteer one first. I just answered.
Naturally, in our community, we have a rural area that we serve, so we have a very small public transit footprint. And so naturally, volunteer transportation programs kind of fill in the gaps of where public transit leaves off. And we use a lot of our funding to support these volunteer transportation programs, funding from 5310 and also community funding that we find to kind of support them with all types of needs, whether it's staffing, a person to coordinate volunteers to provide transportation, or it's funding to share vehicles among volunteer transportation programs, which we do across 6 different agencies. And we utilize 5310 vehicles to create this sharing program, and we pull in funding to pay for insurance and maintenance and fuel. So there's lots of different ways that you can support volunteer programs. If you're drawing in community money, it could be just volunteer appreciation funding, or money for marketing, or help with just connecting these programs with other types of resources or grant opportunities, just to really try to strengthen them, because a lot of them are all volunteer based. They don't have a widespread staff or a large infrastructure. And so when you're coming in from a regional or a larger or more comprehensive perspective, you're able to provide them with stability that they otherwise wouldn't be able to access.
Yeah, and just to add on to that in terms of options for using 5310 funding, if you're a small transit agency, just another thought is contracted transportation is an eligible expense. So if there was like a small private provider or someone you could hire to do those like specialized trips, like fill in the gap kind of trips, 5310 funding is available for that. I also mentioned vouchers. You can offer vouchers to offset the cost of your transportation for the eligible population. I think that's sometimes a challenge here, at least in Virginia, with transit versus 5310, because transit is open to the public, to everyone. So you kind of have to be careful with how you use the funding to ensure that 5310 is only being used for the eligible population. But there are some ways to kind of use those together to make sure that that funding is only going to those populations.
Thank you. And we had somebody in the chat saying that they use the volunteer driver program as well, and a pickup program through Uber, Lyft, or taxi. These are popular for individuals outside the service area for the local transit agency, but also have their limitations as well. The other thing I'd mention about this is if you're collaborating with local communities or local agencies, one of the great things about 5310 funds is that you can use Older Americans Act 3B funding as a match. And so I used to operate a volunteer driver program in a relatively small area, and we used OAA funds to match 5310 in part to support our volunteer driver program, which lessened the amount of match we had to come up with locally and really helped our small community. So I see Bobby has her hand up. So I have allowed you to talk, and I think you can unmute. Bobby, would you like to? Yeah, I can hear you.
Okay, good. So in adding to what you were talking about, the volunteer driver program, we have a volunteer driver program. That's the Center for Independent Living in Eau Claire, Wisconsin. We cover 41 counties with a volunteer driver program, but we also contract with a lot of agencies, ADRCs, senior centers, we have Lakeland with Inclusive. So we have a lot of different contracts that will help pay for rides. Our director too, because we try to look outside the box, he will write small grants that will cover people to go back and forth to dialysis, and so that we can make our 5310 grant stretch. Otherwise, it will run out before the end of the year. But we just try to look at other places that you don't think to look such like Otto Bremer. We have a lot of corporate offices around us, like Otto Bremer, Anderson Windows, writing to them, asking for help with purchasing vehicles, things like that. So we make our money stretch by contracting and also MOUs to help pay for all those rides. So
Thank you, Bobby. And Bobby did a webinar for NADTC, gosh, maybe a year ago. So we can try and find that link and put it in. She talks at length about how they have created this large volunteer driver program in Wisconsin. So thank you.
thank you.
Karen in the chat mentions Karen's from Michigan, and we've also highlighted their program as well. They do a little bit of a different take on that volunteer driver program where the relationship is between the driver and the rider. The rider finds their own driver, and then Karen's program reimburses the rider who then pays the driver. I think, Karen, it's modeled after the TRIP program that was started in California. I don't know if you want to, I can take you off mute if you'd like to talk a little bit about your program. No pressure. Let me find you here. There we go. So, I think you can just unmute.
Can you hear me, Carrie?
I can. Hi, Karen.
Hi, how are you?
I'm doing well, thanks.
Good. I was just thinking of the person that was speaking just before me, and they said that they had to pay for, vehicles and insurance and maintenance and things like that. In our program, we don't have that because our relationship is with the rider and they get their own driver, so they do their own scheduling. And we allot them 200 miles per month, and they send in mileage reimbursement forms, and their driver does have to just sign a letter stating that they do drive for them, and we pay them 55 cents per mile. So this helps us stretch our 5310 funding dollars incredibly, because we do not have insurance or vehicles or paid drivers or maintenance or anything like that. So I was just hoping that, somebody could, mimic our program and save some money and make it stretch.
Thank you very much, Karen, for coming off mute. This is a great topic for somebody to start a discussion in the forum because volunteer driver programs are always very popular in terms of how do you do it, how can you support it. Jane, I see there's another question in the Q&A box. Do we have time for that, or do you want to wrap something else up at this point? You're on mute.
I think we have time for one more, and then we'll wrap it up and get ready to answer the rest of this next week as well as in the forum.
So the question is, does anyone use 5310 support access to transit, perhaps building shelters, sidewalks, travel training, trip planning tools? And Steve did respond that WMATA prioritize improved pathways for users to transit stops. So I'm not sure if you want to comment on that in terms of transit access in 5310.
I was just going to comment at least for DRPT. We have not done any projects that are infrastructure related. I think Steve kind of mentions this a little bit. I think if the grantee, most of our grantees are not transit agencies, they're smaller nonprofits, area agencies on aging. And so I think administering that type of program with a smaller agency would be a little more difficult just because it does go into procurement and infrastructure, building, construction projects, which they're usually not as familiar with. But that is an eligible expense through 5310. But we definitely do offer funding for travel training. The program funds travel training at some different agencies. And then trip planning tools is something we've done at the state level, actually through Steve is my contact there, but through the ICAM grant. So that was a little bit different. We didn't use the 5310 funding for that. But yeah, just to kind of answer that question from my perspective.
Super. Thank you for that. Great discussion. So many good questions. And I'm going to bring it back up my PowerPoint. And in our last 5 minutes, I'm going to just talk a little bit about the online forum. So I hope that everyone has been able to access and get in and log into the online forum. Can someone tell me if you are seeing what?
This is not your presentation view yet.
Pardon me?
It's your presentation, but in PowerPoint view.
Now is it right? Okay, there we go. Thank you. So I hope everyone was able to access the forum to get logged in. Once you're in there, you will find there'll be a recording of the webinar today and a place where you can introduce yourself, and then just sort of an open place where you can ask a question, you can make a comment. We will probably move some of these questions that we've been talking about into that conversation there, and then people can just respond. You are welcome to share resources, your ideas. There is an option when you're responding to someone to respond to the whole forum, or if you want to just respond to that one person, you can do that as well. So I hope everyone gets on that forum and we get some more discussion about all of these great topics. I can tell with 160 some people on it, there's a lot of experience out there. And if we all learn from each other, we can make a real difference for people. So when you're logging in, just remember it's your email address in all lowercase is your username. If you forgot your password, just use the forgot password link. If you have any troubles at all, please email me at jmahoney@eastersales.com. And check back often. There's also, when you make a comment, I think it automatically there will be a little box that's checked that will indicate that you'll get email notifications when someone comments on what you've written. If you don't want those emails, you can just uncheck that box. Any other questions? I think Carrie put in the chat the link that you can use to get to that online forum. And we do have a survey for this webinar in which you will have an opportunity to add any additional ideas of topics or questions that could be addressed next week. We did not get to some of our questions that we were going to talk about regarding the application process, as well as some thoughts on sustainability. So we will for sure be getting into that on our webinar next week. So if you're thinking about applying, we'll be talking about that application process as well as the sustainability. Any last comments from any of you, Carrie, presenters?
No, I'm excited to have connected with everyone. I'm seeing a lot of great information, so I'm learning a lot. So thank you all. And looking forward to next week. I'm sure we'll have a bunch more to talk about.
Super.
Yeah, this is a great audience. I'm learning a lot too, and I can't wait to talk to everybody in the forum.
Mm-hmm.
Great.
Yeah, and
Well,
we encourage you all to, if your question didn't get answered, we have them, we can address them next week. But if you want more immediate responses, make a new discussion thread, try and keep all the threads together. Not everybody posts volunteer driver programs and we have like 5 threads, but I know that there's a lot of interest in several topics, and we look forward to responding to in the forum.
all right. Well, thank you to the presenters and to our audience members. And we will see you next week, and we will see you in the forum. So have a great rest of the week.
Thanks. Bye.